Africa, if you're employed, that's when you get medical insurance. So these are the challenges that we face. If you're an individual and you're not employed, you cannot have medical insurance.
All right, so first of all, thank you very much for arranging this. Thank you all for tolerating the heat, Mr. Faraj Al-Amari, Dr. Farah. The thing is, Dubai has always been a trendsetter in every way. So medical tourism in specific has been one of their greatest achievements, I would say, for us as well as doctors, not just for the end users and the patients. And I think the best thing they can learn from is the packaging. The packaging of the services. I remember back in 2016 when Dubai Health Authority launched the DXH Wellness, which is part of the Dubai Health Authority that is focused on medical tourism. His Excellency Marwan Al-Mullah and Mr. Mohammed Al-Meheri at that time, they put up together something that is very much and we provide to the people who are coming to visit Dubai for the luxury of Dubai. You know, so packaging. The treatment is just part of your fun experience as well, you know, fitting in everything that is required, anything that might be needed or the patient wants just for the luxury of it. And there has been an excellent link between medicine and entertainment in that sector. So I think just the way that it's been portrayed, they utilized all the assets they have in terms of you know, the touristic attractions and all that, fitting all that into medical plans. I think that is one of their strength points, and every country, I think they have at least one or two things that they can integrate into their medical treatment plans.
I'm curious, as a practitioner, since you mentioned this repackaging that's been going on for a few years, has there been a difference in the way that you see patients and guests coming from outside of the city and the country view medical tourism?
I see a lot of luggages in my reception. So no, literally, a lot of them come straight from the airport with their luggage, keep it at the reception, get their treatment done, and then after that, you know, they just take off straight to the airport. And that's why also one of the things that other countries can also put into plan, but that's a bit more private into the clinics, is that facilitate the process for the patient as well. So one of the things we provided at Liberty Dental Clinic is that we provide a limousine service, pick up and drop off, for example. You know, other clinics, I know, for example, Turkey has been doing a lot of those packages where they, part of the hospital, they would book for you your hotel, your flight ticket, they make sure that you get your visas on time. So all that does facilitate to the patient. So I would say that is, you know, that doesn't come strictly from the country and the government. Also, the private sector has to play a role into providing something to the patients.
Would you say that these experiences that are, you know, being designed for patient growth and, you know, just growth of the sector, are they accessible, or what can be done to make it more accessible?
They are super accessible. And for example, Dubai has the dxh.com, which is a website by DHA for medical tourists. And it is so impressive that they have all the A-listed clinics and hospitals in Dubai mentioned on that website with special discounts. And that was one of the deals we had with them, that the discount given to DXH is bigger and higher than any other discount we gave to other corporations. So I think it's very easy, and as well their team from the Dubai government is super supportive. They have like a 24/7 hotline that you can call. They'll help you with your reservations. A lot of people coming for treatment usually are concerned about their visas and all that, so they sort all that out. And I do believe that this had a huge impact on the economy itself of Dubai, not just the medical segment, you know.
Yeah, that's surprising to me as a long-term resident, but it's like incredible to see. I hope it's a great takeaway for everyone to know that this resource is accessible. Dr. Emily, now with, you know, the huge continent of Africa, could you talk to us a bit about the emerging nations that you feel are doing well now, but also have the potential otherwise to succeed, and what is making them stand out?
First of all, Tunisia, Egypt, South Africa, and Rwanda. They're investing a lot in terms of the economy and boosting the medical tourism in those countries. Most of the things that they face, some of the challenges is the transfer of medical records of patients. It's one of the key things I feel in medical tourism where people struggle a lot. And the economies, let me say for instance, Tunisians. The Tunisians, it's right there at the top, right? Most of the people that come for medical tourism in Tunisia are from Europe because it's cheaper to do any surgery, medical tourism surgery in Tunisia and Egypt. Egypt just changed the whole medical tourism industry. They developed the New Cairo, where there's new hospitals, there's packages like you was explaining. They're copying the same system that Turkey is doing, but in Egypt. And it's working. But one thing that I've seen that it's not working in other African countries is in Africa, there's not much reliable medical insurance for people. The insurance and the tourism work well together. In Dubai, let's say you're a resident, you need to apply for your medical insurance. In Africa, if you're employed, that's when you get medical insurance. So these are the challenges that we face. If you're an individual and you're not employed, you cannot have medical insurance. So if they can work on those factors, we're trying to work with most of the governments for medical tourism and to also keep the doctors and work with travel agencies, like a whole package, like you were saying, work with travel agencies, work with airlines, work with hotels and luxury rental cars to give them a whole package that I'm investing into this surgery that is for me. I'm also being appreciated. And the specialists love what they're doing. In Africa, sometimes they fail because it's not like they don't understand what they're doing. They're not given the platform to advance their skills, if I can say that, as a doctor. So limitation of advanced skills are some of the factors that is challenging, if I can say that. But Tunisia and Egypt and South Africa and Rwanda are the top 5 countries that are growing in medical tourism. And we've seen a lot of investments going there in those countries as well, and Uganda.
Where would you say the investments are pouring in from? Is it like primarily government and like public sector led, or overseas private deals flowing in as well?
From private sector. Most of them, governments, I feel like even me, I facilitate most of the investments from private sector, but to government, because governments, they just waiting for someone to do something. It's not necessarily them going out to say, okay, let's advance this sector. No.
Yeah, I mean that's interesting because it's these nations that you've highlighted, clearly they have the potential and it's being recognized by overseas investors. In North Africa, you pointed out to what do you think is making them stand out to investors as a hub to invest and pour money, capital in?
The development of digitization. Without a digitized country, there's no development of medical tourism or any sector. If a government is digitized, it's able to offer advanced services for its citizens. It's able to attract investment.
Dr. Mohammed, you mentioned earlier, and Dr. Emily as well, digitization. Could you give me a couple of examples where you think Dubai is like doing that really well?
Yeah, I will give you an example from my practice. So, for example, today, as we all know, if you go to a dentist, you need to get a crown, for example, or a certain filling. So they prepare the tooth and then they take those annoying impressions and then they send it to the lab to get it manufactured. Back in the days, that was actually a physical process where you need to take the impression, put it in a box, send it to your lab, they get it done, and then they send it back to you with a car or a driver. Today, I know a lot of dentists who are living in Kuwait and Iraq, and some of them are also in the States. Because of the digitization that happened, is that now they take digital scans of the teeth, like a 3D scan, send it by email to their lab in Dubai, which manufactures everything by 3D printing and sends it back to that country. So the process of waiting for the whole first trip, getting it shipped and all that is eliminated. And also for us as a local practice, for our local patients, residents as well, it's much faster because of this I can now 3D print all of my products in-house in the clinic. So a dental bridge or a crown that would usually, back in the days, take us a week of work, we can deliver it now in 2 hours. So you're cutting down from 7 days to 2 hours, and this is all because of the advanced technology. So I think this is brilliant, and the Dubai government has been highly supportive of that. You know, I remember anything that's innovative that we've been bringing into the practice, especially hosting the world's biggest dental conference. This is also another factor, you know, how hosting conferences in the country. The world's biggest dental conference is now happening in Dubai, the ADEC Dental Conference, and it brings almost more than 70,000 dentists from all around the world. So this is not just a conference for you to just learn about the new things, you know. A lot of dentists are coming here, they're like, okay, this is a place I want to live. So eventually it's enhancing the business, it's boosting the business through tourism, because when they're coming here for a conference, they're also flying in as tourists.
Yeah, I mean, so the efficiency is not only on the patient side, it's also practitioners, because it's very cost-effective, time efficient as well.
100%.
All the initiatives that are being deployed.
Indeed, yeah.
You know, you pointed a bit towards like the economic growth. If you can expand on that, and if we like shift focus slightly on wellness-focused strategies and how the development of those, whether like in your practice or you view as an industry leader within the city and the country, how do you think it benefits the economy?
I mean, as we all know, tourism by itself is a huge contributor to Dubai's economy. So there we already have, you know, a bonus that's already listed for us. But in terms of medical tourism, as I said initially, they are utilizing their power in tourism to enhance the medical tourism itself. The thing is, when people you know, come to Dubai, a lot of people think that, okay, I'm going to get a treatment done or a surgery done, but they're not. They are booking a hotel, they're going to the mall, they're buying things to take back home with them, they are eating daily in restaurants. So it's not just the treatment, you're actually enhancing the economy of the entire city and the country. So, I mean that is one way to look at it, and I'm team dentistry today, so excuse me for supporting that. In 2018, I don't know about the latest records because I attended the DHA meeting for medical tourism. Dentistry achieved the highest income in medical tourism for the city of Dubai. So obviously everyone's chasing the Hollywood smile and all the implants and all that. So we have an advantage. But yeah, that's one of the things, apart from many others that I'm sure have improved since 2018 till today.
I'm curious, after Dubai, which are the second or third leading cities for dentistry? Anywhere in the region?
For dentistry? Okay, so I would say Dubai is in the first place, second and third place. And then probably, there's honestly, there's plenty of places, but it's not about the country itself or the city. It's more about where you're going, you know, the facility that you're going to. But I would say there is Kuwait is pretty good with dentistry. They have a huge dental market, very competitive, with good quality. So I think Kuwait can be listed on the map as well.
Interesting. Good to know for the audience and myself. I guess to wrap things up, Dr. Emily, I'd love to hear, you know, forward-looking statements. If we're to think about innovations, trends for the medical tourism and like wellness industry, from your experience with the, you know, investors and yourself, where do you think opportunities lie, and what are things that you're looking out for going forward?
Well, in terms of the investments, it's digital health. There's a lot of investments. If you see G42, which is owned by Sheikh Tanoon, they invest a lot in digital health, medical tourism, startups. Even though the medical tourism startups, they don't know what they're doing, they still invest in them because the potential, it's one of the most untapped industries in the world right now, and it has the fastest growing GDP. So if you look at those sectors where investors are looking at that and they're seeing what type of innovation, how can they integrate AI, how can they do data analysis of medical tourism globally. Dubai sits at number 6 in the world in terms of medical tourism, but there are countries that are more advanced than UAE, but the facilities, like you said, are more important. So we have the best facilities. But one other thing about Dubai is we're not operating at 100% of the facilities that we have here. If we can attract, Dubai Economy Tourism is working very hard to attract most of the tourists to just not take a layover here and leave and go do a medical surgery somewhere, but they're attracting them to come here. There's several initiatives that Dubai Economy Tourism and Dubai Culture and Dubai Municipality that they are taking. We recently partnered with Shanghai for digitization of medical tourism. So most of the other things besides investment is looking at startups. What are they doing? What are they focusing on? How do we integrate what other countries like Shanghai, USA medical centers, what are they doing? Are they investing into the facilities that are growing the sectors, the different sectors in health? Because you're a dentist, you know like how the waiting period is for different people from different countries. And also, let's say for instance, you partner with companies and private organizations that offer the investment. They bring you the customers from different countries and you have several channel partners through that, and you increase your capacity, you increase your medical dentistry.
Yeah, but that's why I said that the effort has to come also from within the facility. Because they need to take that into consideration. You can't bring people in and then tell them, sorry, I'm not available. You know, like for us, for example, we're very well aware of public holidays in other countries. So whoever calls, for example, Saudi Arabia has holidays around Ramadan.
Yes.
So whoever calls from Saudi Arabia during that period of time has a priority to book. You know? So we take that into consideration, and many other things that you can do to facilitate it for them. So I wouldn't say it's purely the government or health authorities. The private sector needs to play a role. The facility has to be included in that as well, and it's a teamwork. It cannot be done just from one side, because if the government puts all the effort, and then the facility itself just didn't clap back in a way, then what's the point? No?
So for me, can I ask you a question? Because I see there's a lot of dentistries here in Dubai, and most of them are operating in a way that they offer huge discounts than like the big ones. But I wonder if they're authentic. The doctors are really registered with DHA and all these things. Of course they are, but like I just feel like there's something that doesn't like there's a disconnection.
Any dentists here? We have one dentist. Okay, you look like a nice guy. Let me speak freely. Anyone that offers you a crazy discount, I'm not going to mention numbers. Anyone that gives you a lifetime warranty on the treatment, you run for your life. Okay, you do not walk in there. But let me tell you something. It's not about, yes, there is plenty of dentists. It's an oversaturated market, but not everyone survives. So whoever has been surviving for a while, okay, you should know that it's safe to go. Because trust me, Dubai Health Authority has been keeping a very, tough grip on all the clinics. So yes, you can start your dental clinic. First year or two, you're going to go out promoting 50, 70% discounts, lifetime warranties, all the 5D, 4D, Hollywood Smiles, all those things. But, I mean, maximum third year, they'll be shutting down. So just know where you're going to. And it's very easy, just Google reputation in general, all that. You can find all the information you need. And that's not just in Dubai. You should see the cases I get coming from other countries, without mentioning crazy
Brazil
stuff.
is one of them. Oh my God, they have a lot of
I like how transparent she is. Like she's not censored.
We love this. We love these intimate conversations.
I'm very diplomatic. All right, yeah. No, so it's in everywhere, but you just need to know where you're going. And dentistry is an oversaturated market worldwide. There's a lot of dentists. A lot of them are graduating yearly. For the number of the population, UAE by itself has over 1,000 dentists graduating every year. Egypt, if I'm not mistaken, around 10,000 or 40,000, some also crazy number. So it's an oversaturated market, but it is very easy to find the legit place to go to.
It's good to know that we have good regulatory places in practice and done by the private and public sector. I've been alarmed for the time, so unfortunately we can take this off stage. But thank you, Dr. Emily, Dr. Mohammed, for your time.
Thank you.
Thank you, everyone, for joining in.
Thank you.